Welcome to A Place for Seniors, where we share the real truth about what seniors need. This podcast features honest, heartfelt conversations, the ones we don't always have, but matter the most. Here, we share real stories and simple insights about aging with dignity, choice, and autonomy. Together, we bring what we've learned from over 20,000 conversations with seniors and their families, guiding you through some of life's hardest decisions. We invite you to listen, learn, and prepare with us, because these conversations matter and the choices we make today shape our tomorrow. Hi, I'm Allison Carmen with A Place for Seniors, and I'm here today with Edward Givens of Health Markets. And Edward, thank you for visiting with us today, because I think what you have to say is really, really important. I didn't have any idea that you even existed, that a lot of people don't know referral agents exist.
Correct.
So I'm really looking forward to this. So
I am too. Thanks for inviting me.
You're welcome. You're welcome. So tell me a little bit about what got you started in being a healthcare strategist, correct?
Yes.
Okay.
What got me started in that, I would have to say, falls back to my parents. Both my parents were educators. My mother taught for over 45 years in the school districts, and my father was in the military, and then he went into teaching as well. But they taught my brother and I to kind of be prepared and walked us through this world as you need to know what's coming.
Oh, okay. So planning.
Planning,
okay.
Yes.
Okay.
Some of it was intentional, some of it was unintentional.
Okay.
But one of those intentional moments was roughly about 25, 30 years ago. They came over for Thanksgiving and handed my brother and I an envelope.
Oh.
And in that manila envelope was the keys to their house, their safe combinations, information about their bank accounts, information about their final wishes. And my brother and I did not want to have that conversation because they're our parents.
How old were you then?
At that point in time, I was in my late 20s.
Oh, wow. That is early. That's early. Yeah. But they were planners. Yeah. Wow. Wow.
But a few days later, my brother and I were talking, and we both kind of went, we didn't like that conversation, but we're good now.
Oh, okay.
Because we knew what our parents wanted.
Yeah. Right.
So it made our jobs easier as we move through time.
Absolutely.
Because mom and dad said this is what they wanted. We just have to confirm that's still what you want.
Yep.
This is what we're going to do.
Yeah.
And so in that type of planning, it's just taught me to be that way. And I was in the military when I first graduated from college. And then when I got out of that, I started working in the medical device field. So I've worked in the healthcare industry for over 20 years.
Oh, okay.
And when
you bet you saw a lot.
I saw a lot. I saw a lot of people prepared, a lot of people unprepared.
Unprepared. What would be the ratio?
More people are unprepared.
Okay. Okay.
And they're looking for guidance because they ask their doctor, well, should I do this or should I do that?
But the doctor may not know.
The doctor may not know, and the doctor doesn't have your insurance.
Right.
Or they know a name of an insurance company.
Right.
But it's not the insurance you have.
Right. Yeah. And doctors know medicine.
Correct.
But they don't know all the ancillary. And that's the same in our field.
Correct.
Right? Because a lot of times doctors will recommend a skilled nursing as the end result.
Yes.
Whereas we, in our industry, want to keep people out of skilled nursings. That's not how we want you to end your life, So
correct. Yeah.
Different way of thinking.
I describe it to people, sometimes they're looking in silos. They know their lane.
Yeah, right.
But they don't know the connections to the other lanes.
Right.
And if we can show people those connections to the other lanes,
right,
then they can navigate better.
Right.
And that envelope that my parents gave me and my brother was the connections to their lane.
To their lane. Right. Well, to their little piece of the lane, though.
Correct.
Right? Because even if you had all of that stuff, if you have an emergency or all of a sudden one of your parents starts failing, what do? Where do you turn to? That wasn't in that envelope.
No, it wasn't in that envelope. But because we had that envelope, it allowed us to have some time to be able to do things.
Right.
I will give you a prime example.
You could educate.
Yes, we could educate. My father did over 20 years in the military. My brother did over 20 years in the military. I spent time in the military. But what we didn't know is from his VA benefits, he had some home health assistance.
Yes, he did. That's right.
And so that was something that we learned along the way.
Right.
And I'm sure there's many veterans out there who don't know.
Well, I bet they don't know, and they probably get a lot of erroneous answers.
Correct.
Is that there is a benefit called the VA aid and attendance. if you were a wartime vet, Korea now, Vietnam, we're going into the Gulf War. We have
Correct.
Gulf War veterans as well that actually pay for assisted living.
Yes.
You have
Depending
to
upon their qualifications.
You have to qualify for it, but there's a lot of veterans. And then what's really cool is there's a surviving spouse benefit that goes with that.
Mm-hmm.
So.
Yeah. And so it's teaching people that there are options available to them. But if you have a plan, then you can ask certain questions.
Right.
If you don't have a plan, then everything's a question.
What does a plan give you? A plan gives you what? Kind of a framework?
Yes. It gives you a framework. And I try to tell people, don't try to keep up with the Joneses.
Right.
Don't think, that I have to have the most expensive community to live in.
Right. Right.
When that may not be my financial capability.
Right. Right.
But I can still live in a community that takes care of me.
Right.
And that I can be proud of.
And that you can be proud of. Because there are a lot of communities I know of.
Yes.
From all different price ranges. In Arizona, we're one of the few states you can live in a community for about $2,200. And then sometimes you can live less than that. Well, but that correct. Includes meals, housekeeping, utilities, maintenance, all your Wi-Fi, your cable, everything. And then all the activities and the socialization is all included in that.
Exactly.
Yeah.
And the funny part is because we have all these baby boomers who are aging in.
Yeah.
They're used to the freedom, the choices, the options.
Right.
And as we educate people on having a plan, that gives them more freedom and choice and options because they've picked it before they're forced to pick it.
Right.
And then when they're forced to pick it, the options become very limited.
Yeah. Well, here's the thing. You can't go into something for $2,200 if you need care.
Correct.
That's going to be more expensive. Why would you need care? Mm-hmm. Right?
Yes.
What happens? You fall, you have a stroke, you have a heart attack, and it's not having that event. It's responding to that event within a certain time frame.
Correct.
So if you fall and you can't get up and you lay on your floor for 3 days, that's going to do permanent damage that you may not be able to recover from. And now you've quadrupled your healthcare costs, right?
Correct.
Okay.
Correct. And having that simple conversation, like my parents had with my brother and I, allows you to have some of that preparation up front.
Right.
Because then we can plan for things. And it's a scary conversation because people don't like to talk about their mortality.
It was obviously scary to you. You didn't even want to have it. Yeah.
Well, I didn't want to have it because we look at our parents and we go, those are my parents.
Those are my parents. They're not supposed to die.
They're not supposed to die. Exactly.
Right.
My parents don't get sick. Well, I'm sick. Wait a minute.
Right. Yeah. Yeah. That's so true, right? I mean, my dad, I don't ever remember my dad being sick.
Correct.
I don't ever remember my mom, but one time when she had her wisdom teeth out, that I don't ever remember her being in bed. She worked all the time,
Yeah.
So.
And I think it's a funny little quirk that, as kids, our parents are everything.
Yeah.
Once we become adolescents, our parents don't know anything.
Yeah, right. Exactly. Exactly.
And then once we become adults, we realize they know a lot more, but they're never going to go away.
Right. Right. They're never going to go away. Right.
And so we have to have that kind of thought process in mind so that everybody, I call it showing love. The best way to show love is to have those conversations. Yeah. Because then we can plan for it.
Yeah. What happens with people that don't have kids, though? I'm running into that more and more.
So with people that don't have kids, again, this is another opportunity to have those conversations with friends, with loved ones, the family they chose.
Right. Good point.
So that they can know what they want.
Right.
And they can know how to take care of them. And they're not going to be lying on the bathroom floor between the toilet and the tub for 3 days because nobody knows.
Yeah. Yeah. They have a support system.
So that they can have their wishes known. I work with people with life insurance and long-term care insurance. And it will always be the younger folks or the single people who are like, oh, I don't need that. There's nobody there.
Oh, yeah.
And it's more of a conversation. That's the point. There's nobody there.
That is the point. That is the point.
So who's going to care for you before you die?
Yeah. Because I think a lot of people, like they'll say, they're going to take me out of my house feet first.
Yes.
You'll hear that a lot, right?
They do,
And they're not.
No.
They're not. And again, I say this over and over and over again. Seniors want choice. They want independence. They want autonomy. They want dignity and respect. Mm-hmm. And if you want that, then we have to pull in professionals, especially if you don't have friends, include them in your support people so that you can be educated. Like
Correct.
you can have your plan
Yes.
and you can consider a choice that you can make on your own and not be forced to make.
Correct. And then you can understand how your family's going to interact. Because like you brought up if someone falls in their home and has an issue. Well, that's one event. That's one domino that fell, but there's several dominoes before that that led to that scenario.
Exactly. What would be those dominoes?
I didn't talk to my doctor about getting dizzy when I get out of bed.
Oh, okay.
I didn't talk to my doctor about feeling stress in my hip, as I'm walking.
Hip flexors, because I'm sitting so much, my hip flexors or my balance is off.
Correct.
Right.
So now I trip and fall somewhere.
Right.
And no one else knows but me.
Yeah.
I didn't talk to my family about what I'd like my wishes to be. And I have a daughter in DC and another one in Wisconsin. And I live here in Arizona.
Oh, yeah. That's very common. Yeah.
And then what are they going to do?
Right.
I do love them and I don't want to burden them.
Right.
But you've actually put more burden on them by them not knowing what to do.
Right. Oh, yeah. Very true. Very true.
One
of the things, I was with a family over the weekend and she's by herself in another state in Idaho. And then her kids are all out here and one kind of travels around all the time. And she says, they're telling me they're very concerned about me. And I said, and she's in her 90s.
Yes.
And I said to her, you're living in a 2-story house and all they can imagine is you falling down those stairs and lying there and not somebody being there. And their heart, when they imagine that, their heart goes from their throat to their stomach.
Yes.
I mean, it just, it is like it stops you in your tracks. And that's what I think a lot of seniors don't realize, that that's kind of a burden, like not knowing what's happening with your parent and then being reactive.
Correct.
If it should happen, right?
Correct. Having that conversation with my parents prepped us because a little over 2 years ago, my father had an incident at the grocery store.
Oh.
Did not know where he was.
Wow.
Didn't know why why he was in the store.
Oh, man.
They ended up calling EMS and they took him to the hospital. Called my mom. She picked him up. Thank God. I mean, he did not hit anybody or hurt anybody on the way or trying to come home.
He had a blank.
He had a blank.
Okay.
But because we have had those conversations,
right.
My brother and I started talking to my parents and said, okay, Dad. I went down just to get eyes on, see what's going on. And was like, nope. I think
they're in another state.
They're in another state.
Okay.
We are here. My wife and I are here in Arizona. They are in El Paso, Texas.
Okay.
My brother's in North Carolina.
Oh, okay. Wow.
So we have the conversation and we go, okay, Dad, Mom's going to drive you around. We would like you to no longer drive. Okay. I'm sure for my father, a very proud man.
Oh, yeah.
It was a moment of, oof.
Yeah.
That mortality moment.
Yeah. We planned, but we didn't know this was going to be it.
We didn't know this was going to be it. But at the same time, because he and my mom had talked to us, he said, you know what? I can do that. What I'd like to do is give my truck to my grandson.
Oh.
So my brother and his son flew out and my dad did a whole little ceremony and gifted him his truck.
You know what's so funny about that? And just in thinking this, I went back to college in the 90s. And my dad was in his mid-70s, maybe middle 70s, maybe 76 or so. And he gave me his truck to travel from here to ASU, from Phoenix to ASU. And I realize now, because he had a stroke, but none of us even paid any attention to it.
Yes.
There's 5 kids and Dad had a stroke. He's invincible,
correct.
Right? That's what we thought.
Yes.
And so I thought, he was really nice to give me his truck. You know what he was doing? He was saying, I can't drive.
Yes.
That's what he was doing. I just dawned on me.
Yes. but there's those little things like that we see, but if we're not talking together,
right,
we don't see.
Right. Well, and also that, I would say as you get older, even like your dad probably was having some memory lapses before.
Yes.
But he wasn't going to tell anybody about it.
No, he wasn't. But as we've talked through it, we're like, yep, we saw it here.
Yep.
We could see it there.
Now we can see it. Yeah. Yeah.
But again, we're not healthcare professionals.
Right.
We don't see this all the time.
Right.
So, he's just getting older.
Yeah.
oh, he's just tired.
Yeah.
I might be inflating things. That may
Yeah.
not
I don't want to make a big deal.
Yep.
Right. Right.
But again, if we have those conversations, that's why when I'm talking to clients and I'm working with them,
Yeah.
I want to understand your situation.
Yeah.
There may be a tool that we can use that I can supply, or there may be a resource like you that I can use to help them.
Right.
So if I understand that first, then it's like, hey, guess what? We have a plan.
Right.
We've got a strategy.
I think that you've called yourself like a quarterback.
Yes.
Like a healthcare quarterback, which is different to me. I've never known that those even exist. Mm-hmm. And so you're also a Medicare specialist. So you know the ins and outs. Also, you come from a family of doctors. Is that correct?
Well, on my ex-spouse's side, she's a doctor. She's got 4 sisters, and 3 of them are doctors.
Oh, wow. Okay.
And my middle daughter is a nurse. So I've got a lot of resources.
A lot of medical. Right. But what that gives you, especially in the industry you're in, is the ins and outs, like things that can be coded wrong, things that all of a sudden your Medicare insurance doesn't pay for XYZ.
Correct. And especially right now, there's a lot of changes and adjustments that are going on with Medicare. So some people make certain assumptions. I'll give you a prime one. A lot of people will have a Medicare supplement. Yeah. And they will feel comfortable that I can go anywhere I want. Mm-hmm. Well, in 2026, there's a new rule that for certain procedures, they're going to require prior authorizations for people on original Medicare with a Medicare supplement. Oh, wow. Wow. So what procedures are those? Do you even know? Those usually are going to deal with pain management. Oh, well, they all have that. Yeah. I mean, arthritis, that's what happens. Yeah. Yes. But Arizona is one of the states that's piloting it. So there's about 6 states that are piloting it. Wow. So we'll see how this goes. Okay. Where people will push back. We're seeing Medicare Advantage plans that are adjusting their benefits. Some Medicare Advantage companies have left certain communities, certain counties. Wow. So now people are like, yep. Choices have been reduced. Wow. So people are trying to figure out, okay, what do I do next? Yeah. Yeah. I think one of the examples, and we've talked about this before, was a senior that was living in Payson. Yes. Yes. And then got Air-Evac'd. Correct. Yes. They were Air-Evac'd from Payson down to... They're on Medicare. They're on Medicare, yes. Okay. And they were on a Medicare Advantage plan. They got Air-Evac'd from Payson down to Maricopa County. And they have to do that because the services aren't in Payson. Correct. Okay. Rural area services aren't in Payson. Mm-hmm. Their initial bill, okay, and I always tell people, take a deep breath. Yeah, never pay the initial bill. Let's take a look at what's going on. Was $90,000. Oh my gosh. Yep. Oh my gosh. Obviously, they did not pay that. Yeah. But whoever you are, if you see a $90,000 bill and you're like, I wasn't even operated on, hold on a second. Wait. Yeah. That price was reduced. It was much more affordable because her insurance covered it. Oh, good. Okay. Okay. But at the same time, she lives in Payson and she's like, well, wait a minute. If I've got to keep doing that, I can't keep paying that co-insurance to come down here. Yeah. And then I have to spend time in Maricopa County away from where I live. Who's going to take care of me when I'm in the hospital? Who's going to advocate for me? Which we don't realize. You can't just have your senior go into a skilled nursing or a hospital without an advocate. Correct. You have to have somebody there managing the communication and what they're saying and what it means and what the choices are. And they're asking you to make decisions and you've got to have somebody there. Correct. You've got to have somebody who's going to kind of step back and take a look at it. Right. Because again, the doctors and the nurses are trying to do what's best for you. Yeah. But it's still a business. Yes. And so certain aspects of the business have to be dealt with. Yeah. But we as consumers are in pain, injured. Well, how are you making decisions? We're under stress. Yeah, under stress. So how do we make a good decision under stress? Right. Right. I've told people before, people will spend more time picking out their next car than they will spend figuring out their health insurance, picking an insurance plan. Wow. They'll usually spend about 2 weeks figuring out how to pick out a car. Yeah. And they'll spend less than an hour. I was going to say. And I'm going to say, anybody who's listening to this, when your group plan's annual election period comes up, do you do it on Friday the night before midnight.
Oh, yeah. Oh, yeah.
And most people
And there's
do.
nobody to talk to.
There's nobody to talk
There's nobody
to.
to ask.
Yep.
Right.
And when it comes to Medicare, seniors sometimes will do the same thing.
Right. Well, it's so complicated. So like we've talked,
Yes.
like I'm definitely going to talk with you, and we're going to talk because I'll be 65 this year.
Mm-hmm.
So we're going to talk about what the best plans are. And I get, a lot of my friends, I'm on this one. I'm on this one. I don't know that those are right for me, where you can look at me and you can say, hey, Allison, this is what your health care needs are going to be in the next, say, 4 or 5 years.
Mm-hmm.
Let's look at these different plans. This is where you are today, and this is what we want to consider.
Yes.
And
when I walk through that with people, I educate them on the options. Again, I don't want people to try to keep up with the Joneses. I want it to work for them, because choices we pick now can affect you down the road.
Oh.
And some of them can be penalties that are lifelong.
Wow. Wow.
I had a client who was healthy when he turned 65 on no medications whatsoever.
Uh-huh.
Did original Medicare and chose not to get a prescription drug plan.
Uh-oh.
Once he turned 72, 73, started to have some medications, wanted to get a prescription drug plan.
Couldn't?
Well, we had to wait till the annual enrollment period.
Oh, my gosh.
Okay. So that was the first part.
So now you're paying out of pocket.
Correct.
Until that time. Yeah.
And then you incur a 1% penalty for every month you did not have a prescription drug plan.
Oh my gosh.
Yes. So now instead of potentially paying, and I'm just using general examples, let's say his plan could have been like $20.
Yeah.
Okay. He's got to add the penalty on. So now he's paying $30, $40, maybe $50.
Right.
Instead of the 20.
Right. Which is a big difference. Especially if you're living on Social Security and a small pension or something like that. Yeah.
Correct. And that's a lifelong penalty.
Yeah. You can't get away from it. Wow. That's amazing. Yeah.
And so just having that conversation, people who work for groups and they have a group plan, the group, if you're Medicare eligible, they'll kind of say, yes, you could be on Medicare, but they're not going to take that risk of advising you what Medicare plan to take.
Okay.
And so some people will, my friend said do this. My friend said wait for that. It's like, but does that work for you?
Right.
If you can sit and talk with someone about that, then you can understand what your options are.
I've always been like, I can never sell insurance. It's way too complicated for me. It just really is. Whereas somebody looks at senior living and they're like, wow, that's too complicated for me,
Correct.
But it's what we like, what we are interested in, what we've studied, right? And we really know the ins and outs. How many people, when the enrollment time comes up, and say I'm 72, and shouldn't I be consulting somebody about that?
Yes.
Okay.
We should always be doing that, because there are different options that may be available to you. So
because it's constantly changing.
Correct. It's constantly changing. But let's say you're 72, and let's say it's somebody who's on a Medicare supplement. Mm-hmm. So original Medicare with a Medicare supplement, that will cover roughly 20% of what Medicare doesn't cover.
Yeah.
As far as covered services.
Oh.
So you pay 20% of Medicare covered costs. Uh-huh. The Medicare is going to pay the other 80%. You get a supplement to help you with that 20%.
Right.
Okay. Now, you get a supplement, you have a monthly premium. But let's say that you got your supplement in a state like California or New Mexico. That same supplement premium may be lower in Arizona. Okay. So if I started in California, now I live here in Arizona. Reevaluate to see if it might be lower.
Well, and then the other thing was, let's take Our Lady in Payson. Mm-hmm. So she says, you know what? I need to move down to Maricopa County.
Yep.
What can happen? She can change her plan.
She can change her plan because she's moving counties. Yep. So she's moving out of the coverage area of her Medicare Advantage plan. That gives her a guaranteed issue enrollment period.
Wow.
Which is another nice scenario for people because now they have some new options.
Right. Okay. Yeah.
But that's where we help explain these things to people. I often tell people who are kind of on the fence back and forth, Medicare supplements allow you to pick anybody who accepts Medicare.
Yep.
Medicare Advantage plans are run by private companies, so they have some rules and they'll keep you in their networks.
Okay.
Well, one thing to think about as you get older, I often tell people you pick your own HMO, because we'll get a list and they'll go, well, here are my doctors. These are my 5 doctors. Mm-hmm. That's your HMO that you simply self-created.
Right. Exactly.
So if it's possible to find those 5 doctors or providers in one Medicare Advantage plan that works for you, that might be the way to go.
And you can do that.
Correct.
Like in minutes.
Yes.
Okay.
Because we get a chance to look at all that. That's some of the differences in people can go to Medicare.gov and they can see the different Medicare plans that are out there. What they don't see is the responsiveness of certain plans, the strength of certain plans. Yes, they'll have a star rating, but when you call and you have a question, do you get a response?
Is that your expertise then? Because you're in and out of it all the time and dealing with issues all the time.
Yes.
So you kind of know that. That's kind of like me with knowing the different teams and the different nuances.
Correct.
That are
the personalities.
they're not on Medicare.gov. They're not a star rating. They're not, it's the expert that's in that, doing that every day that really knows that and why.
Correct.
And do you charge for your services?
No, our services are free to the consumer because the federal government regulates how we get paid from the insurance companies. And so that's how we get paid, period.
Yeah.
From the insurance company's perspective, they're like, go to Medicare.gov and pick a plan because then we don't have to pay a rep for that.
Right. Perfect. But we need to pay a rep.
We need to pay a rep for that.
Same with us. Yeah. Wow, Edward, we're done. We can you believe it? We went that fast like that. Thank you so much for coming. It's just been wonderful, and I can't wait to do it again because we have so much to talk about.
Yep. Okay. One, take a look at that.
Oh yes, defend the legacy.
That's just a mock-up.
Yeah, this is a pamphlet that you give all your clients.
Yes.
That is really in depth, and then they can take that home with them, and then they have more questions, and they can ask you those.
Yes, and they can ask their family those questions.
So that
perfect. They start to develop that plan.
Okay, great. Well, thank you again.
Oh, you're welcome.
Okay. All right.